everybody saying, my sister went for chemo, my cousin went for chemo. That word chemotherapy does not necessarily mean medication that are supposed to help you alleviate or treat cancer. No. Chemotherapy basically means that you're using a chemical substance to kill or destroy or even inhibit the growth of a cell that is invading in the body. But that agent, that medicine that you're using, has minimal or zero side effect to the host cell. So chemotherapy is using a chemical agent to alleviate or destroy an invading parasite or microorganism with minimal or zero side effects to the host cells. This means you have an invading cell which is new to the body and the immune system of the body. And now you have your immune system targeting this. But the immune system is unable to do that. So therefore you have to supplement your immune system. And how do you supplement it? You give it a medication. This is why I always tell you that drugs are not necessarily supposed to treat or kill the entire condition. What drugs do is they come in to lower the multiplication or the growth of these microorganisms, and then your immune system takes over. Okay? This is where you people mess, because you think drugs are coming in to kill everything, kill the microorganisms, and then protect you. No, that is not true. The drugs that you're taking are actually just coming in to assist your immune system, because it's already now, it's unable to handle this case. So it needs some form of input, some form of ammunition, so that it can use that as it boosts itself. Now, this part of boosting immunity is where you guys go wrong, because you forget to talk about it. And you'll see, even when you're talking about cancer, rarely will you hear doctors or oncologists or even nutritionists talking about the nutrition aspects of this therapy. You can never treat cancer, and I put that treat. You can never treat cancer without boosting your immunity. Why? Because your immunity is the one that will take over the chemotherapeutic agents and, number one, help you fight the invading cancer cells, and number two, help you recover from the side effects of the chemotherapeutic agents. Understand that. So immunity is there specifically to help you recover from even the side effects of those chemotherapeutic agents that you're using, even the radiation. So that is chemotherapy, and that is by definition. But look at it this way. Cancer is basically your cells, but they have evaded the cell cycle. So here it's where it gets interesting. We have a cell cycle, just like a life cycle. Remember when we talked about HIV? We talked about the life cycle of HIV. Now here we have a cell cycle. Now this cell cycle is where cells are born, they multiply, they go through mitosis and meiosis, and then they yield differential cells. And then when they leave this cell cycle as adult cells, they can go and differentiate and do something else. But this cell cycle regulates this life cycle of a cell. From the time it's born, from the time it multiplies, and until the time it dies, it's regulated by a cell cycle. This cell cycle is actually also regulated by hormones. Hormones. That is where the challenge comes in. So when a cell evades or escapes the cell cycle, it is not able to be controlled by these hormones, because these hormones rely on just limiting the cell's growth through this cycle. But when the cell gets a way to evade that cell cycle, of course, through DNA destruction. So sometimes we alter the structure of DNA, and then these cells cannot be recognized by that hormonal control or that the chemical control of the system. So it evades the cell cycle, and when it comes out of the cell cycle, it starts to misbehave. But remember this, all of us make these cells on a daily basis. But how did God create us? The perfect architect is God. What did God do? God designed the immune system to actually destroy any cell that is evading this cell cycle. Because the immune system has to understand that if this cell evades this cell cycle, disaster is looming, because this cell can end up multiplying rapidly, and then as it's multiplying rapidly, its mechanisms will overwhelm your immune system. Once they overwhelm your immune system, that will mean that now you are unable to control it. And that's how that happens. That's how cancer can to occur. And now we cannot take this cell back into the cell cycle because it's already evaded. So your immune system clears it up. But look at this. These cells that evaded the cell cycle came from your own stem cells and came from your own body system, which basically means, from the definition of chemotherapeutic agents, you need a medication or a chemical that is going to target this cell that has evaded the cell cycle and destroy it without causing any harm to your own cells that are part of this cell cycle. If you're thinking, you'll start to realize that is very difficult because this cell has the same components as your normal cells, only that it evaded the cell cycle. So definitely it is now overreacting. So the challenge with cancer medication, the so-called chemotherapy. So when I say cancer chemotherapy, that's now specific. The drugs that are used to eliminate cancer cells with limited or less or no side effects to your cells. But you see, these cells evaded the cell cycle, which means, of course, they're your own cells. That is where the challenge comes in chemotherapy, because now it becomes difficult for you to start treating cancer. Because if you give a chemotherapeutic agent to target your host cells, how are you sure that these drugs will target only your cells and not only the cancer cells and not other cells? Yet they have the same structure. They have literally almost everything is the same, only that they evaded the cell cycle and started to behave. That's where the challenge comes in with chemotherapeutic agents for cancer. Now, rewind and let's go back a little bit. Cancer, when you are diagnosed with cancer, of course, there are different things that are done for you to be now confirmed that you are a cancer patient and you need chemotherapy or you need attention, medical attention for that matter. This is where I got a lot of challenges. I realized in Kenya, counties like Marsabit, counties like Isiolo, Meru, Wajir, and Mandera, and even Garissa, these are counties that people consume or chew a lot of miraa. When people are chewing this miraa, they are using maybe a chewing gum or groundnuts. Chewing gum is sugar. They are using soda or energy drinks. And then they drink water, bottled water. So it is a package, like a miraa package. When you're buying that miraa or mogoka, as famously known, you're buying that plus soda, plus maybe sugar. Some of you use sugar. And nowadays, people are even using amoxicillin, the antibiotics, to chew miraa. Miraa is cut. For those people who are not Kenyans, miraa is what we call cut. It's a stimulant of the CNS. It contains amphetamines, and these amphetamines stimulate the central nervous system, and that's why they don't sleep. They get these false illusions. They just create stories all over, and it's totally a mess. So they lack sleep because of just chewing that cut. So these people, they use that. Soda is sugar. Now they're using antibiotics, which is a problem. But this miraa are being sprayed. They're being sprayed with glyphosate, the chemicals, to just control herbs and pests. Now they're chewing this, and then remember the following day, they go and take either diazepam or they take amitriptyline. These are drugs that depress the CNS. Now, number one, how crazy is that? That you have to stimulate the CNS to just depress it later. This is a system that can operate on its own. It can get stimulated by a biological clock. It's called the circadian rhythm. It can wake and sleep when time is right. But you decide, I'm not going to sleep. I'm going to chew this product. You chew it, you stop yourself from sleeping. And the following day, you are having problems with sleep. Now you're asking me, how can I help myself? If actually you're on these platforms, how can you even answer that question? Somebody's asking me, how can I get out of these side effects of chewing miraa? But when I was sleeping, you're busy chewing, you're busy stimulating your CNS, you're busy going against the body's way of living, you're busy going against the biological clock. And now in the morning, you don't have sleep. And because you're idle, of course, because how then would you sleep during the day when people are working? So now, during the day, you want to sleep, you don't have sleep. Now, when you don't have sleep, you want a medication to come in and help you fix what you caused to your body. You go and take either diazepam, and nowadays diazepam is being sold over the counter. Number two, you go and take amitriptyline. Amitriptyline is an antidepressant. So you're taking drugs for depression to actually help you suppress your overreacting central nervous system. And then now, of course, you're forgetting that you're going to suffer the side effects of these medications. Of course, you'll come back with the side effects and you need another drug to calm your side effects. But that aside, when you wake up or when you want to spit that product out of your mouth, I realized most of these people run to the pharmacies to take esomeprazole, pantoprazole, or omeprazole. So these people are always suffering chronic gastritis. And of course, before they started their program, they ate a lot of bad foods, the inflammatory foods. And if you are from these counties, you know how the Kushite generation, the Kushite people, how they abuse seed oils. They actually cook literally everything with seed oils. They use a lot of sugar. They even add sugar in rice. And then they eat a lot of processed carbohydrates, the spaghettis, the macaroni. And then now they are seated here chewing mirror and taking soda. This is a disaster waiting to happen. Why? Because one, this mirror that has been sprayed with glyphosates, you are actually chewing chemicals that are actually going to predispose you to cancer. That is one. Number two, you are actually using sugar and loading your system with sugar. And cancer survives on sugar because there are two energy sources of cancer. One is glutamine. Glutamine is an amino acid that is present in literally all foods. It's very hard to avoid it. But the beauty about it is that this glutamine is the lowest form of energy for cancer cells. About 5 to 10% of cancer energy comes from the glutamine. When you hear people telling you that stop eating foods that are rich in monosodium MSG, monosodium glutamate, that is a form of glutamine. But the synthetic one, the original one, or the organic one is in foods. The genetic one and the synthesized one, the lab one, is the one that is present in that processed food, in that what are they called? These products that we dip in water to just make quick foods. The noodles. It is present in the milk, the powdered milk. It is present in most spices. You know those spices, those cubes that you use to make your sukuma wiki taste like it has meat? That is MSG. And then you start wondering, I ate spices yesterday and I got gastritis. That is MSG destroying your gut. But it's interesting how people will change the story and start blaming the chili peppers. When I eat chili peppers, I get gastritis. But they've taken chili peppers with that cube. I don't want to mention the name. If you know the name, you can mention it in the comment section. They consume that cube and then they add chili peppers. Now they blame the chili peppers because somebody told them chili peppers. Yes, that is the name. Koi, that's the name. So they will chew that, they'll eat or consume the chili peppers. Well done, check. But they'll add on the processed spices and then blame the chili peppers because that's how we are designed anyway. Yes, Vinny, that is the answer on YouTube. So yes. So when you're doing these tubes, you're thinking that you're actually making your food taste as though the sukuma wiki has meat because it's low budget. And that tube, I think, is about 5 shillings per cube. But you see, what are you doing? What are you doing? You're loading your system with MSG. And MSG is monosodium glutamate. That is one source of food for cancer cells. That is one source of issues, actually mutations that will start in your DNA and in your mitochondria. So you're actually initiating the process of cancer cells to start misbehaving. You're initiating this process of these cells evading the cell cycle because you're going to mess up the DNA. And then the glutamine in that MSG will start feeding the cancer cells that are actually evading the cell cycle. What do you expect after that? So when I tell you to stay away from processed spices, please listen. Listen. Those people did not design those. There is no meat in that product. There's no chicken in that cube. There's none. It is MSG that masks your taste buds so that you get to taste foods in their unnatural forms. So you think foods are sweet. That chicken that you eat all the time, that sweet junction of yours, the one that you line every Tuesday to just get the crunchy chicken, that is MSG. It's going to mask your taste buds and it's going to mess your system generally. It is highly inflammatory. And remember, cancer spreads so fast through inflamed tissues. So not only are you giving it glutamine to survive, to feed on, you start by initiating DNA mutations so that it can evade the cell cycle. That is one. Number two, you weaken your immunity so that these cells can actually survive. Number three, you provide glutamine, which is food for these cells, the cancer cells. And number four, you create inflammation in the system and cancer spreads faster through inflamed cells. Those clients that have had who we've had conversations on cancer, it is so annoying that these people are still on seed oils and nobody mentioned it to them. They've done 8 sessions of chemotherapy. They have done 7 sessions of radiation. They've even gone for breast surgery, breasts removed. They've been given those silicone breasts. And then, of course, radiation was done so that to prevent further spread of cancer, to prevent. The word is to prevent further spread of cancer. So now they're still consuming those processed spices. They are still eating sausages and smokies. They are still eating canned foods. They're still eating sugar in all forms, including fruits and honey. They're still consuming wheat products. They are still drinking alcohol, but in moderation. The Daktari said in moderation. So they're actually feeding the cancer and then creating inflammation in the system where this cancer can actually spread. Because cancer spreads so fast during germ species. So now it's time for us to face realities. So when you've now been diagnosed with cancer, the next stage is either you get counseling, then you go for the treatment. And every time you hear you've been diagnosed with cancer, everybody gets into a panic mode. Because the image that has been painted to us about cancer is basically a death sentence. You're dying, you're going to die. Some people have even been told, now you are at stage 4, now you're going to die. You need only 5 months to die. Even though you're going to take the chemotherapy, you will die. But let me go back to the story of the mirror. As they're chewing this mirror, they get the gastritis. They keep on taking omeprazoles and antacids, and they mask symptoms of gastritis. This is one of the reasons why, by the time you are diagnosed with stage 4, or by the time you're being diagnosed of cancer, the gastric cancer, and these counties have high rates of gastric cancer. By the time they're being diagnosed with this stage, this cancer, it's a stage 4 or stage 3. The throat cancer, the gastric cancer, the colon cancer, stage 3 or stage 4. Why? Because all the time they're lining the pharmacies to buy omeprazoles and desomeprazoles. So they're actually basically masking the symptoms every other evening. Every other morning they spit the mirror. Now it's time to sleep. They take diazepam. When they wake up, they have gastritis. They take omeprazole and then they eat. They eat the same foods that led them to where they are. Then tonight, during the night, they are chewing the same herbs, the same mirror that brought them where they are. Now, those cases will not stop. Why? We will walk with placards on the roads. We will demonstrate about how cancer is dangerous and how cancer one day it will die. But nothing will happen. We will actually be increasing the rates of people who are suffering from cancer. The numbers will keep on skyrocketing. As we carry those placards, as we bring in those NGOs, as we pretend to be caring about people who have cancer, and then the whole day we've been pretending to care about people who have cancer, and in the evening or in the afternoon, we are there cutting a cake to celebrate that day, the Cancer Awareness Day. We are cutting the cakes. We are drinking soda. We are toasting. We are passing a message that cancer will one day die. But cancer cannot die when you're still feeding on the same things. It will get worse. Let's be realistic. Let's not sugarcoat things for the sake of content. Let's not sugarcoat things for the sake of likes and views. Let's be honest with each other. That if you have cancer, it's high time you start dropping those foods. Don't ever rely on these chemotherapeutic agents or the radiation or immunotherapy or hormonal therapy to change your life, or even surgery. That is fixing the symptoms. When you do away with the breasts, you've not done away with the high estrogen in the system that caused the breast cancer. When you chop off the intestines and replace them, you have not fixed what caused those intestines to go wrong, because the body is always struggling to get a balance. The problem is we keep on feeding the body with non-nutritious foods, worst products, industrially processed products. And the immune system is struggling to find the ammunition. So you have a gun, yes, but it's not loaded. And the tags are here. So how do you expect that gun to protect you? Even if that tag comes with a slap, you will give in. Because you don't have any confidence. You don't have any army to help you fight these conditions. So as we insist on chemotherapeutic agents and drugs or therapy for cancer, including surgery, let us also be vigilant. There was a time I went on a TikTok live for this lady. There's a lady who is actually championing championing breast cancer awareness and survivors. So ladies come there to share their stories about how their breasts were removed. And these ladies are half naked. I know most of you have seen that. This lady was actually shot a video on top of a lorry without a top, without anything, just showing people the aftermath of the surgery of the breasts that were removed. So through showing them that, you're trying to motivate them to prevent cancer. You're telling them to go for screening. And I tell people, mammography, when you go for mammography screenings, you are going to expose yourself. Of course, I'm not against this. And by the way, this channel, the content that I share on this channel is not supposed to actually come in and replace your doctor's prescriptions or your doctor's advice. Follow your doctor's advice to the latter. This is to open up your mind. So this is a lady who has her breasts chopped off and she's showing them out so that you see that she's so confident. Now listen, you can champion a journey for cancer survival without showing us your nakedness. Let's be honest. You can still tell us that your breasts were removed and we will still believe because we don't see them. You don't have to show us the scars for us to believe. Of course, seeing is believing, but this is a very sensitive field. Now, when we start analyzing her journey, we start analyzing what she eats even now, the same person who is still championing for breast cancer survival, for breast cancer and chemotherapy, well, you just get tired. You just get tired. The food that they are eating, she actually prepares meals on live on TikTok without a top. Without a top. Because she wants you to buy the idea, the sympathy. Listen, when you are diagnosed with any disease, don't expect any sympathy from anybody. Don't expect to see any sympathy from anybody. Nobody cares. If you went through chemotherapy successfully, well done. But you see, we don't care. That, let me just be honest, nobody cares. You walked that journey and you walked it alone. That's why we were not there when you were walking through that journey. And it's okay to share your story. It's okay to share your story. But simply no, we don't care. We might act because human beings have this thing inside them to act as though they do care. They don't. They don't. They don't. If they do, they will actually, if actually you do actually yourself, you do care about preventing cancer, you will not be cooking these foods, you will not be using the seed oils. But I understand the misinformation that is out there is the one that is messing people up. But anyway, that story aside, let's go back to our journey. 4 ways, or even 5, or even 6 for treatment of symptoms of cancer. Number 1 is surgery. But before you do surgery, of course, radiation can be there so that you can just, and the chemotherapy, so that you freeze those cells in one place so that you can easily remove them through surgical removal. Well done. So we give you chemotherapy to target the cancer cells, to make sure they don't spread, and now to get rid of them. But listen to this. I said cancer spreads so fast through inflamed tissues, right? So you tell me, how is chemotherapy going to confine these cells at one place for you to to just carry out a surgery and remove those cells, and then do a radiation to just kill the remaining cells? How are you going to do that when you have not fixed what these people are eating? How? They are still eating foods that are actually causing systemic inflammation. So how then are you going to tell me I'll take this drug and this drug will come in to fix the inflammation? It is not going to fix the inflammation. I will only fix inflammation through fixing my kitchen. So as much as I want to take this drug to concentrate these cancer cells or the tumors at one place so that I can easily extract them through surgery, how about me creating room for the spread of these cancer cells? How? How will I do that? And as you eat those, because imagine they have done these surgeries, they've done this chemotherapy, and miraculously God came through because, of course, chemotherapy came in handy. So you get your healing. But you know that soon you might come back. You know very well. You're even scared within. You just can't say it. But inside you, you're scared. Possibly this can come back. And they will even tell you. And as we'll be talking about the side effects of chemotherapy, you'll get to understand that one of the major side effects of cancer drugs is actually cancer. Take a minute and think about that. Take your time and think about it.